Hi there, my name's Julia. I'm going to be your nurse today. And today we are going to be putting in an NG tube. And this is because you've developed a paralytic ileus. So what that means is that in your small intestine, things aren't moving properly like they need to be. So today we're going to be inserting a tube from your nose into your stomach, and we're going to just be taking the contents of your stomach out, okay? And this is going to allow us to treat the paralytic ileus. So first, can I just take a look at your name band? And I'm going to grab my doctor's orders. So can you tell me your first and last name?
Kelly Boyd.
Awesome. Can you spell your last name for me?
B-O-Y-D.
And your birthday?
May 16th, 1972.
Awesome. And I'm just comparing your MRN number to my doctor's orders. Awesome. Thank you so much, Kelly. Okay, so Kelly, do you have a history of a broken nose or a deviated septum or any surgery on your nose or anything like that?
Nope.
Okay, perfect. Now, I'm just going to ask you to place your finger on a nostril and blow in and out like that, and do it to the other side, and tell me which nair is more clear for you.
The left.
The left side? Okay, perfect. So that's the side that we're going to be inserting the NG tube into then. So, first thing I'm going to do is I'm just going to measure how long my tube needs to be. Like I said, it's going to run from your nose into your stomach. And I'm going to put this on your top here so that we don't get anything on your clothes. Okay. So this procedure, Kelly, is going to be quite uncomfortable for you. I'm going to be inserting the tube into your stomach, and as it goes down your throat, you might feel a burning sensation. You might feel the need to gag. And that's okay, that's normal for this procedure, or that's common at least. So I've just measured from the tip of my patient's nose, ear, to the xiphoid process. I've ripped the end. Now I'm going to compare the length to my Salem sump, and I'm using a 10 French Salem sump. And Kelly, what it's going to look like is I'm going to be inserting the tube into your nose, and once I get it past your nares, I'm going to ask you to tilt your head forward, and I'm going to continue to insert past your nasopharynx, and then I'll get you to tilt your head back up, and I'll give you this glass of water, and I'm going to ask you to take big sips of water, and as you swallow, I'm going to advance the tube all the way down into your stomach, okay?
Okay.
And if at any point you need me to stop for any reason, just put your hand up, okay? And I'll know that you need to break. And before we start this procedure, Kelly, do you need to use the bathroom?
Nope.
Okay. So I'm just marking my tube so I know where to stop inserting. There we go. Okay. And I'm going to lubricate the tube so that it minimizes discomfort for my patient. Okay, are you ready, Kelly?
Yeah.
All right, I'm gonna give this to you now. Oops, here we go. And I'll tell you when to swallow, okay?
Okay.
All right. So first, facing me. You don't need that right this second. Facing me. And I'll just switch it like that. Perfect. All right, are you ready?
Yes.
Perfect. And do you have any questions before we start?
Nope.
Okay, so I'm gonna start advancing then. Okay, I know it's uncomfortable. Okay, and past your nares, can you please tilt your head forward? Almost touching your chin to your chest. Awesome, and I'm going to continue to insert. Okay, and then past your nasopharynx, can you lift your head back up? Looking at me. All right, now, Kelly, can I get you to take big swallows of your water? And as you're swallowing, I'm advancing the tube. Swallow and swallow. Okay, perfect. There we go. Thank you. So now, take that. Thank you. And I'm just going to anchor this to you. Now, ideally, to check placement, what we would be doing is we'd be getting an X-ray, and that would tell us for sure that the tube is in your stomach. but unfortunately that's unavailable right now. So what we're going to be doing is a couple other tests. So the first test I'm going to do is I'm just going to check to make sure that the tube is not coiled up inside your throat. So yeah, open wide. Awesome, that looks good to me. The next test I'm going to do is I'm going to inject a little bit of air into the tube, and I'm going to just be listening for the rush of air into your stomach. So, here. I'm going to inject some air into it first. So, there's some air, not too much. Don't want to make you uncomfortable. Okay, so I'm just going to be listening stomach for the rest of air. Awesome, and I heard that. So next, I'm going to just take a sample of gastric contents. So I'm just going to suck some up here. There we go, and I see that I've got some liquid there. And I don't want this to drip on you, so knock that off. Go. Okay, so 2 ways I'm going to look at this gastric fluid or contents. First, I'm looking at the color, and I see that it's green, and that makes me feel pretty good about it being in the stomach because gastric contents are green. And next I'm going to do is I'm going to put some on my pH strip here, and I'm going to compare the pH. So just putting some on there, and I'm hoping that this pH will be 5 or less. And when I compare to this sheet, I see that it is less than 5, so that's perfect. Awesome, so at this point I'm very confident that I have it in the stomach. So I'm going to secure it to my patient's nose so that it minimizes irritation on the inside of that in the nasal mucosa. So take this sticker off, and then I'm going to use some skin prep to make sure that it sticks. Here we go. So that should make it nice and sticky. And I've already prepared this strip for the nose. And I'm going to wrap it around the tube. And Kelly, how did that all feel for you?
Good.
Okay. Do you have any questions for me?
Nope.
Okay. Go. Alright, so if you feel like it's quite uncomfortable on your nose, you can give me a ring on your call bell. We can see if there's anything we can do to minimize discomfort. I'm going to attach this to the suction according to the doctor's orders, which I see is just low intermittent, so go, this is my suction. And Kelly, if you need to go to the washroom at all, you can just ring your call bell and we can help get you disconnected from the suction, and that wouldn't be, oops, so tight for you there. Okay, and very last thing I'm going to do is I'm just going to attach the tube to my patient's gown, or in this case, sweater. And there we go. Okay, thank you so much, Kelly.